Good evening, welcome to Healthline. I am Gregory Zarian.
And I'm Suzanne Watley.
Tonight we are talking about stress. So our question is, how do you handle stress? How do you handle stress?
Not very well.
Not very, okay, that's two of us. Both of us don't handle stress very well. What do you do? Do you take a long walk, or do you dive into a pint of Ben & Jerry's?
Chronic stress is a problem in our society that's become huge with multiple health side effects that are bad. We're trying to be all things to all people and yet trying to be faithful to ourselves at the same time. We've got two experts on Healthline tonight who are going to guide us through stress relief. Welcome to Carolina Huerte Lehman. She is a psychotherapist. She's in private practice here in Glendale. Thank you so much for being here. You also direct the Employee Assistance Program at Glendale Adventist Medical Center. Talk a little bit about what stress does to us.
Well, as you mentioned, stress can be very detrimental to our health, our mental health, as well as our physical health. Many times you might find that you're either suffering from lack of concentration, maybe your sleep is impaired, maybe you're overeating, as you mentioned, and maybe you just generally feel a low sense of energy and lack of well-being. And so stress can affect us in so many different ways. But at the same time, I think it's important to mention that stress in general it's a way of life for all of us as humans. Mm-hmm. We all have some level of stress throughout our day. And like right now, for example, here we are in talking about stress and on television.
We're getting stressed.
We have a little bit, but it's an appropriate stress. It's a stress that helps us, be excited.
Okay,
about
so then
do.
there's a good and bad stress then.
Exactly, there is. There's stress that we need just to get through our day and to accomplish the things that we need to accomplish.
Can we really control the stressors in our life? Can we just tell ourselves, oh, don't stress out about it? Does that do any good?
Well, probably not if the stress level has gotten to such a severe high level that we need some help with it. We need a way to find how to manage the stress. I think general low-level stress, yes, we can say to ourselves, relax, this is fine, you're going to get through this show, everything's going to be good. But yeah, when it gets very severe, then you do need help.
Coming up, we'll tell you of a form of meditation that will help de-stress your life.
Hello, I'm Carolina Huerte Lehman, Director of the Employee Assistance Program at Glendale Adventist Medical Center and a psychotherapist in private practice in Glendale. I'm here today to talk to you about stress reduction and several ways to deal with it. Meditation is a way of reducing your stress and anxiety, and you can begin doing that by focusing your attention on your breath. If you feel your breath at the tip of your nose as it goes in and out, you will notice an immediate reduction of your stress level. Some of the benefits of mindfulness meditation is to increase your concentration and focus and attention. It also helps with decreasing your blood pressure and bring about a general sense of well-being.
I am a swimmer. I am a dancer. I am a mother. I couldn't be me without the Spine Institute at Glendale Adventist.
Their renowned specialists provide everything from physical therapy to advanced surgical techniques for your neck and back pain. Glendale Adventist Medical Center, helping you get back to life.
Welcome back. On tonight's episode of Healthline, we are talking about stress. Does the stresses in your life, do they make you suffer? Carolina, what are some of the effects that happen to the body in regards to stress?
Well, there's many, and I think right now I will mention the most prominent ones that we know of are hypertension and stress, which produces the stress hormone cortisol, can affect your digestive system, and as I just mentioned, hypertension, And so the other effects of stress can be the way that it affects your mind, your concentration, and it can even lead to depression and anxiety.
So it can also affect your performance in regards to work and how you are at home and with your family.
Absolutely.
Interesting.
I read about an interesting study of medical students. Right before they took their big exam, they were given a task to do, and they did it much more poorly right before the big exam than a month after that hurdle was completed. So it definitely does affect your performance.
It really does, and I think that one of the ways that I like to talk about stress with individuals who come to me for help is to begin to pay attention to your body in terms of the physical symptoms that you may experience, as well as the emotional and psychological symptoms.
So like if you have a stomach ache, or if something breaks you out into a cold sweat, your heart starts beating, stuff like that, right?
Right. If you are noticing that you are continuously having certain symptoms, then I think it's important to have obviously a medical evaluation. And often people who go maybe to the emergency room feeling anxiety, palpitations, they may think they're having a heart attack. And so often they say, well, they said it was nothing, that I'm okay. And so we begin to find out that their level of stress is so high and they really hadn't paid attention to it. So it's become anxiety. It's become anxiety, and then it needs further treatment.
And this is affecting the chemistry in our brain?
Yes, stress can affect the chemistry in our brain. There's something in our body produces stress hormones, as I mentioned. And so those hormones travel in our system, and they can impact our mind, our brain, as well as the rest of our body, as I mentioned before.
So then how do hospitals treat stress? What happens if a patient comes in and they're stressed? How are hospitals able to treat patients with stress?
Well, typically, if an individual comes in with high stress, let's say to the emergency room, and they really are found that they're not having a heart attack.
Which is probably an anxiety attack,
It's an anxiety attack, and so there may be, typically there's a referral made to either a psychiatrist or a psychotherapist to help that individual manage their level of stress.
I accompanied two different friends to the emergency room for panic attacks, and they were convinced they were having a heart attack, and I believe they both received a drug called Ativan. What does that do?
Well, first of all, I just want to make sure that you know, and I'm sure you do, I'm not a medical doctor, so I'm not qualified to give you all of the ways
but from your experience.
But from my experience, Ativan is an anxiety reducer medication, and it's very effective, in particular for panic or anxiety attacks.
Now, what you do is teach this mindfulness meditation. Tell us a little bit more about that.
Well, mindfulness meditation is a 2,500-year-old form of Buddhist meditation that has been brought into the mainstream, in particular by psychologist Jon Kabat-Zinn about 25 years ago. And now it is being taught out of Massachusetts General Hospital as a meditation to be utilized for stress reduction, not necessarily tied into any religious practice. But because of a lot of the research done with mindfulness meditation, there is a lot of evidence that mindfulness meditation reduces the level of anxiety and therefore, of course, the stress level by reducing some of the chemicals that that stress produces in the brain.
Coming up on Healthline, we're going to be hearing from a substance abuse counselor and expert to talk about how you can constructively relieve your stress without hitting the booze or
the buffet.
drugs.
The buffet.
The buffet.
Hi, my name's Scott Robertson. I'm the director of Glendale Adventist Medical Center's Alcohol and Drug Services. The staff, the patients, everybody at Alcohol and Drug Services, when we have stress, when we're having a problem, the rule of thumb is to not go it alone. So we reach out for help. whether it's our patients doing therapy in group, whether it's our staff making decisions as a team, the key way we reduce our stress is by sharing the burden. Going through any situation alone will make it worse. Going through anything together will help to alleviate the burden and reduce your stress.
At Glendale Adventist Medical Center, our heart specialists understand you have questions about the health of your heart.
At Glendale Adventist, they fixed my daddy's heart.
At Glendale Adventist, they fixed my heart.
We offer the latest cardiac services and technologies. Do you know your heart health? We are Glendale Adventist Medical Center, healthcare at a higher level. Here on Healthline, we're talking about stress, what causes it in everyday life, and how best to effectively deal with it. We've been talking to psychotherapist Carolina Wete-Lehman about the problem in a clinical setting, and now we're going to have joined us on the program Scott Robertson. He is the director of the Glendale Adventist Alcohol and Drug Services. Welcome.
Thank you, Suzanne.
Great to have you here, Scott. Scott, what does stress look like then when it lands at GADS?
By the time someone comes through the doors at GADS, they've been trying to have meaningful relationships with other people, and those relationships have failed. And how that seems to happen is maybe something as ordinary as they drive home from work, they walk in the door, they had a terrible drive home, and they say, I had a terrible drive home, and the family's preoccupied. Someone's watching television, someone's cooking dinner, someone's doing homework. No one really responds. Person goes into their bedroom to change their clothes. They're still annoyed, they still have a feeling that hasn't been addressed. And that unaddressed, unresolved feeling can turn into a resentment.
And that's also validation.
Well, what it is they haven't received validation.
They haven't
been
validation.
heard.
Okay, interesting.
So by the time they get to us, they've been in relationships with their family, with their colleagues, where they haven't been heard. Or maybe they've been heard, but they weren't getting the feedback. They weren't feeling like they'd been heard. So the feedback process was incomplete.
Interesting.
Carolina, do you see that in your practice? People come in with these frozen feelings because of incomplete communication. They're not getting soothed by the loved ones that they depend on at home.
Absolutely, and I totally agree, with Scott in terms of the kinds of ways in which people develop not only self-esteem issues, but depression, and many of the other psychological disorders that can also lead to addictions. And so I see it in my office when people come in wounded, emotionally wounded, and really feeling lost as to where they belong in life and how to find the kind of love and connections in their lives with their people who they love.
How can we stop it at the door? Keep people from becoming addicted or becoming alienated or so shut off that their feelings are completely immersed? Like, could I go to a hospital and be screened for stress?
That's great. Yes?
In a variety of ways. Maybe the hospital isn't the first place that you'd be screened for stress. Maybe in your doctor's office. There are a whole set of disorders that you talked about in the first half of the program with Carolina that develop as a result of stress. So maybe what each of us can do is work on our own relationships. When we walk in the door loaded with stress from a situation, we need not accept that no one heard us. We can stop before we go off into the bedroom, stomping away from a situation where we felt unheard, and we can stop and say, did you hear what I said? Can you help me with this? Instead of demanding behavior, we ask for help. So that's maybe where the process begins, is right at home. In our relationships, we ask for people to help us.
And that goes back to what you've talked about before with us, is really just speak what your needs are. I need you to hear me. Are you listening to me? And it's, again, validation about not being given a compliment, but validating the fact, I heard you, and I know that you had a hard day. I'm sorry that your day was rough. I'm sorry that things happened this way, because we just want to be acknowledged, not ignored. Acknowledged, not ignored.
That's right. If we're having feelings, and they pile up on other feelings, whether they're happy feelings or sad feelings or all the range of feelings that we can have, and we don't share them with another human being, and they don't acknowledge back to us that not only that they've heard, but they may take it a step further and share something they experienced that they think is like that feeling to see if they got it right. When people engage in validating, feedback-driven communication, their stress level doesn't increase. So they don't go from one situation, add a little more stress, and it stays unresolved. Another situation, add a little more stress, and it stays unresolved. They stop the cycle at some point by insisting on being heard.
And it's so simple because all we want to do is be heard. So, great takeaway with that. Do you actually spend enough time listening to your loved one? When we come back, more on how to deal with stress. Are you listening? Don't go away. We all have one thing in common, and that's stress. How do you deal with your stress? I decided to come out into the community and see how the community deals with their stress. When you're stressed, what do you do? How do you alleviate your stress?
Well, sometimes I eat.
When I'm really stressed out, I like to go for a good hike. I go to Runyon Canyon a lot, or a good jog always really helps.
Well, I spend a lot of time with my eyes closed.
Okay.
I meditate. Well, usually I just go outside and take a walk, or I just go in my room and turn the music on and start dancing.
What would you say to people that actually eat when they're stressed? Yay or nay?
Well, you can't, you gotta eat, so it's okay to eat. But then don't eat too much, and then try to exercise some too.
And also make it a healthy choice when you eat.
Yes.
Taking 15 minutes out of the day for yourself, I think is really healthy.
So hike, read a magazine, get out of your head, and just take some personal time. Eyes closed.
Oh my God.
Okay. Breathe in. Breathe out.
Okay, so for stress release, you suggest to everyone just to dance.
Yeah.
Okay, ready?
Okay.
Music's on and go. Okay. We heard a lot of amazing suggestions as to how to de-stress. Eating, hiking, meditating. What do you do every day to de-stress? Create something that you love, create something that's going to stop your mind and create a happy, healthier day. This is what I got. We'll see you next time.
Running is life to me. It clears my head. A day is not complete unless I've gone for a run. So when my knee started to ache, I didn't know what to do. My physician referred me to the Therapy and Wellness Center at Glendale Adventist. My physical therapist quickly assessed the problem. We worked together to strengthen my knee and fix what was wrong. Now I feel stronger than ever. Thanks to the staff at Glendale Adventist Therapy and Wellness Center, I feel more like myself again.
Welcome back. Tonight we were talking about stress. So when you get home and you've had a rough day, do you actually stop and tell someone in your family or someone you love that you really just need them to listen and hear how your day has gone?
You know, you can't always change your circumstances, but you can often change how you feel about them. Carolina, as a psychotherapist, you've said that a lot of our stress emanates from how we are taught to feel about ourselves. Can you explain that?
Okay. Well, we all react differently to stress and to stresses in our life. So you can't really say formula, we all respond this way to stress. A lot of the ways that we respond to stress has to do with the way we've learned to feel about ourselves, often from maybe the way we were treated as we were growing up, or about circumstances in our lives that we've had, whether they're not necessarily all about our childhood, or although a lot of it is, a lot of it stems from the way that we learned to feel about ourselves from childhood. But there are things that happen in our lives, as you probably are aware of, that are circumstances at work, for example, the way that we maybe have heard messages that make us feel bad about ourselves, or in adult relationships that we've had.
So if we're feeling bad about ourselves, does that give us a negative outlook on life?
Great.
Yes.
It does.
Absolutely. And that is really one of the ways when I talk about, the way that we manage stress is the way that we feel about ourselves, is that we may have developed a negative way of reacting and sort of what we sometimes call in the clinical setting, and is they developed a negative dialogue, a negative self-talk. And so before we know it, the fight or flight reaction of stress in our brains. The fight reaction can look like, oh, I'm so dumb. I should have not done that. Why did I do that?
Well, you get something out of beating yourself up and insulting yourself and cutting yourself down,
and
which
so
I'm sure you hear a lot of, Scott.
That's one of the reactions that we are actually doing to ourselves. No one else is telling us that but ourselves. And then the other extreme is the flight. That, you know what, I'm not going to pay attention to that. Everything's okay. I don't care if they don't listen to me. I don't care if my family doesn't care when I come home exhausted. I'm just going to have a drink or something like that.
People don't really care. They don't really not care. They just tell themselves that to insulate themselves from the hurt feelings of that, I imagine.
So that's the way that the dialogue that we sometimes have developed internally that increases our stress instead of decreasing our stress.
Real quickly, what are some of the real concrete steps that you can take to physically and emotionally reduce the level of stress in your life? Scott?
Well, really concrete things that each of us can do are to take a kind of a middle path when it comes to things like diet and exercise and sleep. In treatment, we set up a very structured program for people to have a certain regimen about when they go to bed, when they wake up. They go for a 30-minute walk each day. They spend some quiet time individually. Those are ideals that we could all walk away with. We provide 3 really well-balanced meals for each person every day. In the morning after they get up, they go for a 30-minute walk. That's a good example. We aren't telling them they need to work out in the gym, they need to have a personal trainer, they need to get ripped. What we're telling them is take a 30-minute walk. It'll make them feel better, and it does. Our patients, when they leave in the morning to go for the 30-minute walk, they might not seem very together as a group. They might even seem noticeably annoyed. By the time they walk back, they're happy, they're talking, they're interacting with one another. It's small things like that that are very concrete we can each do to reduce our stress level.
But can I also add it within that, Scott, too? It's the same thing with the family or with someone that you're in a relationship with. You wake up and you're in a really bad mood, but if both of you get up and leave and do something physical or maybe have a healthy diet, your mood will change. True?
Your mood will change, and it's especially, Greg, when you're talking in the morning, those are classic times to abuse what? Caffeine, nicotine, and sugar. And if you use that artificial boost rather than the natural boost, that artificial boost is going to diminish in a short period of time afterwards. The high that we get from sugar will drop after we get to work if we start with sugar. The
caffeine will drop.
Better mood that we get, the elevation, the stimulant that we get when we take nicotine, that drops in a matter of minutes. So those little artificial boosts, they aren't really the solution. It's that whole person approach that seems to make the difference.
So why don't you have a glass of warm water with lemon and an apple? When we come back, amazing stress-free tips to help you lead a healthier lifestyle. Don't go away.
Hello, I'm Dr. Dennis DeLeon with Glendale Adventist Medical Center, and I'm here to share a brief health tip with you. Have you ever struggled with feelings of depression, sadness, loneliness, anxiety? Well, if you have, you are not alone. 1 in 5 Americans have suffered from depression at one time or another in their lives. If you have depression, there are effective treatments available for you, such as medications or talk therapy or psychotherapy. If you are one of those who might benefit, consider enrolling in a free trial. We are offering 10 weeks of counseling through psychotherapy with a program associated with our hospital. Please consult the attached information.
I've been golfing for years. Golf is not just recreation for me. It's part of doing business. Lately, my swing keeps slowing me down, and the pain in my hip is making me feel old. So I went to see an orthopedic surgeon at Glendale Adventist Medical Center. I found that I needed hip replacement surgery and was pleased that they offered a minimally invasive approach. I was back at work within a week, and my swing is better than ever. Thanks to Glendale Adventist, I'm back in the game.
talking about stress and stress management here on Healthline. Put it in perspective for a second. 200 years ago, we were living under very different circumstances. We went to bed and rose with the sun. We walked everywhere we went for the most part, got a lot of those endorphins going in the brain. We cooked our own food. We didn't eat out of a box or a can, and we were surrounded by big families, and we were getting all kinds of support from them. So we're wrapping up our segment here, and Carolina, I want to ask you, where do you start when dealing with stress?
Well, one of the ways that I believe is the best way to start with stress is really being aware of it. Awareness is the key to stress management. If we deny that we are feeling symptoms like we mentioned before, hypertension, nervousness. A lot of people going, okay, tell me, what is it? I feel nervous, I feel worried, my mind is jumping from thought to thought. And so we can begin to identify that.
So acknowledge the fact that we're
stress.
stressed. Just basically go, I'm being stressed. I'm
Just
stressed out right now.
And that's okay. You know, that's one of the things that we let people know. As you mentioned, of course, we live in a very high-paced society, and there's many things that can trigger stress. And so with awareness, the other thing and the other method or practice of stress management is what we were talking about earlier, which is mindfulness meditation, a form of meditation that teaches us how to utilize our breath in order to bring our attention and focus to just the present moment by feeling our breath at the tip of your nose as it goes in.
Breathe in.
And out.
Because when we get stressed, we don't breathe.
Exactly.
Scott, you see a lot of that through people that come through your doors. What is a great antidote that you want our viewers to take away in regards to how to de-stress?
When we're stressed, the number one thing that will keep us sick is keeping it to ourselves. We have to reach out for help. And we have to, know what we need and know that we need to be heard. So find people who can listen to us. That's what we need to do.
How can people get a hold of you, Scott?
They can call Glendale Adventist Alcohol and Drug Services. It's 818-242-3116, or shoot me an email. That's roberts1@ah.org.
And Carolina, how can people find you?
People can call as you know, I am both representing Glendale Adventist Medical Center as Director of the Employee Assistance Program. Our number is 818-409-8327.
And contact you personally in your practice?
And contact me personally in my practice. My phone number is 818-545-7474.
Thank you both so much for being here.
Thank you.
And we hope that we gave you some awesome takeaways in regards to how to de-stress. We also want to add prayer, meditation, and a beautiful one is the two strongest choices you have are your feet. If you're in a stressful situation, take yourself out of there.
And one more thing to perhaps consider doing, get the electronics out of the bedroom and make more time for intimacy, because that's where a lot of de-stressing takes place, or potentially can.
So, on behalf of Suzanne Watley and myself, have a great night, and remember, the most important thing you have is your health. So take a deep breath and have a conversation about it. We'll see you next time.
Good night.